You've probably heard of renal failure. It means the kidneys are unable to perform the excretory functions to maintain homeostasis. So this is going to affect all body systems. It results in decreased urine production, disturbed fluid balance, disturbed pH balance, disturbed metabolism, hypertension, etc. So with acute renal failure, the kidney function deteriorates very rapidly. It may be impaired for weeks and then show a sudden slowing or stopping of filtration. And recovery of partial or complete function is possible if you survive the initial incident of acute renal failure. Chronic renal failure is over time. Progression can be slowed, but condition is not reversible. This disease is managed by restricting water, salt, and protein intake, and this will reduce the strain on your urinary system, because if you're not eating as much protein, you're not making as much nitrogenous waste. If you're not drinking as much water, you're not making as much volume of urine. Acidosis is a high acid concentration. It would be low pH in the blood, and this can be neutralized with something that's basic, such as bicarbonate. Sodium bicarbonate is baking soda. So dialysis will take place. Dialysis is a process of passive diffusion across a selectively permeable membrane. Hemodialysis is going to use an artificial membrane to mimic the kidney. This regulates the concentration of all of the ions and nutrients in the blood. With acute renal failure, the kidneys may regain partial or complete function. With chronic, the treatment can slow the progression but not stop it. And hemodialysis can just relieve the signs and symptoms of renal failure. It is not a cure. A cure, I guess, would be a renal transplant. And the success rate of that certainly is better than it used to be. But you will be on immunosuppressive drugs. So the urine the urinary tract transports, stores, and eliminates the urine. It can be visualized using a pyelogram, where you would see the ureters. So here you can see the renal pelvis, the ureters, the urinary bladder, and below that would be the urethra. We have 2 ureters, 1 urethra. The urethra extends from the neck of the urinary bladder to the exterior of the body, and men have a longer urethra. Urination is called micturition. The wall of the urinary bladder has 3 layers. The internal mucosa, then the submucosa, and the muscularis. Now, the muscularis layer, also called the detrusor muscle, has inner and outer layers, and it is the contraction of this detrusor muscle that will push out or expel the urine. In a male, you can recognize this as a male because there is a prostate. There are 2 sphincters, an internal urethral sphincter, and this is involuntary, and an external urethral sphincter, which is under voluntary control. And children learn to control this when they are a couple years old, although some people have kids who can't control it for a long time. The urge to urinate appears when there is about 200 mils of urine in the bladder. And after urination, there's usually less than 10 mils left. Which part of the pathway of urine flow is under voluntary control? The external urethral sphincter. What are the primary organs of ion excretion? Ooh, tricky question. Kidneys and sweat glands. I'll talk a little bit about urinary disorders. They are detected by changes in the volume of the urine, the frequency of the urine, what the urine looks like. There may be pain. A kidney infection would be called pyelonephritis. There could be kidney stones, renal calculi. Cystitis is the urinary bladder would be an infection of the urinary bladder, and urethritis would be infection of the urethra. Dysuria is painful urination. So the pain, here's the location of some of that pain. Pain in the superior lumbar region or the flank that radiates to the right upper quadrant or left upper quadrant can be caused by kidney stones. And dysuria, painful urination, can occur with a UTI. In males, an enlarged prostate gland can compress the urethra and lead to painful urination. Some important signs of urinary system disorders: edema or swelling. Renal disorders can lead to too much protein in the urine. This is called proteinuria. And that means you don't have those proteins in your blood to maintain the osmotic pressure. So you get swelling around the body. There may be fever with an infection. Abnormal urine output and frequency, increased urgency or increased frequency of urination, changes in output. Incontinence is the inability to control urination, and retention is the inability to urinate. So at every physical, you should be providing your urine to be tested for all kinds of things, for protein in your urine, for glucose in your urine, for the pH, and so on. Pretty easy color test. But in addition to testing for those chemical characteristics in the urine, you want to see what's in. You want to see particles in the urine. So you spin out the urine in a centrifuge, and you look at the urine under the microscope, and you may see crystals or deposits called casts. You might see clumps of red blood cells or clumps of white blood cells. And so here are some examples of things you might see in the urine.